name is Leslie DeGroat, and I'm a registered nurse, and I serve as the division's clinical coordinator. I am joined by my colleague, Misty Archer, who serves as one of the division's administrative office support assistants and also serves as the division's gatekeeper for the health risk screening tool process. And she's my valuable teammate. This is an informational call for implementing the Missouri Division of Developmental Disabilities Health Risk Screening Tool, or HRST process, if you are a residential service provider agency. We are currently in implementation phase 1, in which residential service provider agencies can voluntarily begin implementing the HRST process for residential waiver participants, and support coordinators can voluntarily begin implementing on individuals they support who have non-residential waiver services. You will be given information today about the MO DD HRST process. After reviewing this webinar, if you choose to move forward with implementation, we will be having monthly implementation calls starting in October. Please reach out to our mailbox and we will forward you the invite to join the call to move forward and implement. We will be posting the email to our mailbox for those interested in the HRST process during this presentation. It will appear on a slide and we will put it in the chat. The Health Risk Screening Tool, or HRST, is a tool used, which I'll just probably refer to it as HRST mostly. Anyway, this screening tool, sometimes called a screen, sometimes called a rating, those words can be used interchangeably. It is a tool used to provide early detection of health risks and destabilization. The MO-HRST project has also designed standardized electronic health risk support plans, or HRSPs, templates in the intellectability or MO DD HRST system. With that will support the team with identification of implementation strategies to mitigate risk and improve health outcomes. The completion of the HRST and any applicable HRSPs will align with the individual's annual Individualized Support Plan, or ISP meeting. Information entered into the MO DD HRST system will be accessible electronically to all identified team members, providing a more efficient and effective system for interdisciplinary team member communication and direct accessibility to identified health risk, planning, and service information. This access will also provide a more efficient and effective process for ongoing monitoring to ensure individual waiver participant health and welfare. The MO DD HRST process is designed to have the individual, to their fullest extent possible, and their identified interdisciplinary support team, such as family, friends, paid support staff, registered nurse staff, support coordinator, collectively complete the HRST. The HRST will be completed during the month of the scheduled ISP meeting to assist with the identification of additional supports in any services outside of any required health risk support plans. So who does the MO DD HRST process apply to? The process applies to individuals receiving 1915C home and community-based waiver services. We have 4 waivers in Missouri, and they are Community Waiver, the Comprehensive Waiver, the Partnership for Hope Waiver, and the Missouri Children with Developmental Disabilities, or also called the MO Kids waiver. And so it'll apply to all of these. So why is the Division of Developmental Disabilities initiating this process? Well, the process is designed to serve as support to ensure individual waiver participant health and welfare. Information entered into the MO DD HRST system will be accessible electronically to all identified team members, providing a more efficient and effective system for interdisciplinary team member communication and direct accessibility to identified health risk planning and service information. There is also a message center in the system in which a person working with an individual can send messages to other interdisciplinary team members, which can facilitate communication so that the team can continue to work together to support that individual. For example, if an individual appears sleepier than usual while perhaps at their dehabilitation, the dehabilitation provider could very well message the residential service provider or support coordinator or whomever, just to let them know how that person's day is going. It would really make that easy and really help facilitate that type of communication. And then maybe, maybe that person has just started a new medication and it's making them more tired, or there could just be other things going on with that person. And so the people who are supporting them, it's just great to all be on the same page and just kind of know what's going on with that individual. So that is kind of a bonus along with the screening tool with this MO DD HRST system. And that's just one example that I could think of to share. So the Division of DD is working directly with residential and support coordination provider agencies that have requested to initiate implementation of the MO DD HRST process. Residential and support coordination provider participation is encouraged during this phase of implementation. Participation at this time will support final process enhancements prior to full statewide implementation, which is scheduled to align with the connection go live date in calendar year 2023. So at this time, residential service providers and support coordination providers can voluntarily implement and be able to provide feedback and work through adapting to this new process before it is mandated for implementation in 2023. Currently, it is projected to be mandatory in May of 2023, and that is, again, just to align with connection. So how does a residential service provider initiate the process? Well, your first steps right here by listening to this informational webinar. However, if you are interested in further exploring and moving forward, please use this mailbox. It is capital MO, capital M, capital O, D, D, HRST project at dmh.mo.gov. And we will drop that in the chat. Please reach out to us through that. It is a special email just for MO DD HRST questions and just in any old thing HRST related. So that way we can address that and answer it as quickly as we can. So when should all MO DD waiver participants have their initial health risk screen completed by? Well, the targeted timeline is to have all of the DMH-DD waiver participants receiving their initial HRST screen in May of 2024. So all people will start being screened May of 2023 if they haven't already started in the process. That way everyone will have that full year to have had their initial screening. So when should the HRST be completed? The HRST, or the screening or rating, is to be completed during the same month every year as when the individualized support plan meeting is conducted. So during that planning month prior to the next ISP implementation date. It does not have to be done during the planning meeting itself, and it can be a separate meeting. In fact, that might be a good recommendation for when you're starting to roll it out, is to have that as a separate meeting, just so that person's, not you're not overtaking that support coordinators planning meeting and kind of having that special time with the individual and direct support professional to complete that screening. The process also requires that HRST be updated throughout the ISP year when changes in status are identified that change any of the 22 HRST rating item scores. For example, if an individual who served has support needs that have changed, let's say, God forbid, a person had a stroke and then it affected how they eat or walk or any other items, with their activities of daily living, the person designated as the rater will update that screen to reflect those changes. And then that will populate new health risk support plans based on the scoring in there. And that will help direct support providers how to support that individual. So how long does it take on average to enter the information for a health risk screen? Well, on average, the health risk screen takes 30 to 45 minutes to enter the information for the person. Initial screens and screens for individuals who may have complex health needs may take a little bit longer. So who enters the health risk screen information for the person? The designated HRST rater is responsible to enter the health risk screen information for that person. The rater is responsible throughout the ISP year to keep the HRST updated as it pertains to changes in the person's health status in accordance with the rater training. So who is that designated HRST rater? The designated HRST rater is the assigned residential RN for individuals receiving home and community-based waiver residential services. For those who are receiving non-residential services, the support coordinator assigned to that person will be the rater. So for residential services, it will be the assigned residential RN who will act as the rater. So who should be present to assist the rater with information to conduct the HRST process? So the person for whom the health risk screen applies, so the individual served, we want to encourage that person to be able to participate to the best, to just to their comfort level, best of their abilities, because it is, it is all about them. And so, any participation from that person is very important. Anyone that the person requests to participate to assist with information pertaining to their current health needs. So if the individual wants someone to be with them during the screen, that's perfectly acceptable. This should also definitely include a direct support professional that knows the person very well. That's for when the person is receiving residential services, of course. And then if there's any other kind of friends, family, or other people that might be able to answer questions related to their activities of daily living, they may come as well. But the core group is the RN rater, individuals receiving services, and then the direct support professional who knows them well. Now, let's see. Okay, now I'm going to turn it over to Misty to talk about um, oh, here, no, I'm not quite ready yet. Sorry about that. I'm jumping ahead, you guys. Let's see. Oh, there we go. Okay, sorry about that. Now I'm going to turn it over to Misty to talk about MO DD HRST system access.
Thank you, Leslie. I'm going to steal the folder here. So how does an agency receive access to the MO DD HRST system? Each division contracted provider, whether it be a service provider or targeted case management, aka support coordinator, will be required to have at least one gatekeeper. The division will work directly with Interdisciplinary, which is a company who created the health risk screening tool and is contracted to be our support with the MO DD HRST process. The division will work directly with Interdisciplinary support staff to create the provider-level gatekeeper account. Provider-level gatekeepers will be provided a user document to outline the MO HRST gatekeeper process upon submission of their request to the division. The provider-level gatekeeper will then have the ability to request accounts with intellectability for the remaining users in their agency. How long is the gatekeeper training? The gatekeeper training is on average about 30 minutes to complete. The person who is in your agency's designated gatekeeper will receive an email from Intellectability with a link to be able to set their password with their login information. With this, they will be able to log into the MO DD HRST system. Once the gatekeeper logs in, they will have the gatekeeper training come up to complete. It will be stored in their training library so they can access the training for a refresher at any time. Also, each agency can have more than one gatekeeper. It is a good idea to have at least two eventually so that way you have a backup. How long is the training for the role of residential RN? The HRST online rater training, additional MO HRST training tutorials can take on average 8 to 10 hours total to complete. The trainings are assigned and required completion upon the team member's initial first-time request to ask access the system for the specific assigned role. The training is structured so that the team member can work at their own pace to complete the training requirements. They can pause at any time if needed. The training tutorials upon completion will also be available online to the team member for additional review anytime throughout the process. What will the identified residential RN role provider access to? Upon completion of the required trainings, the team member will have full edit and view access, which will include the following information for a person that they provide DMH DD waiver services and supports to and are assigned in the system. Health risk screen information, applicable health risk support plan information, monthly residential RN oversight documentation, medications, and diagnosis information. What is the requested role for identified residential service provider team members? The role for identified residential service provider team member is titled Interdisciplinary Team Member. How long is the training for the role of interdisciplinary team member? This training can take, on average, 1 to 2 hours to complete. Information regarding the HRST, including a 7-minute video, will be provided. Additional online training tutorials will be provided to the identified team members. The trainings are assigned and require completion upon the team member's initial first-time request to access the system for the specific assigned role. The training is structured so that the team member can work at their own pace to complete the training requirements. The training tutorials upon completion will also be available online to the team member for additional review anytime throughout the process. What will the identified interdisciplinary team member role provide access to? Upon completion of their required trainings, the team member will have view access, which will include the following information for persons that they provide DMH DD waiver services and supports to and are assigned in the system. Those would be health risk screening information, applicable health risk support plan information, monthly residential RN oversight documentation for persons receiving waiver residential service. Note, identified and assigned residential service qualified developmental disability professionals will have edit access in the residential RN oversight monthly documentation module to provide their monthly signature. Now I'll turn it back over to Leslie to talk about the health risk support plans.
Thank you, Misty. All right, health risk support plans. What is a health risk support plan, or HRSP? Well, the MO DD HRST process includes design standardized electronic health risk support plan templates in the inelectability or MO DD HRST system, which will support the team with identification of implementation strategies to mitigate risk and improve health outcomes. The completion of the HRST and any applicable HRSPs will align with the individual's annual individualized support plan meeting, as we discussed a little bit ago. So when is a HRSP completed? The HRST, upon completion, assigns scores to 22 health and behavior-related rating items, such as eating, ambulation. It deals with different kind of disease processes like gastrointestinal, and behavioral manifestations, just different things of that nature. So anyway, each of those items scoring a 3 or higher will trigger the need for the team to complete the applicable health risk support plan template for that rating item. The individual and their team have the option to access and complete a specific health risk support plan for any rating item that scores below a 3. It's required for 3 or higher, but you can always do one if someone you think might benefit from having that completed. The completed health risk support plan will include the incorporation of service and training considerations identified by the HRST to mitigate identified areas of health and behavioral risk. The completed health risk support plans will serve as an attached component of the healthy living section of the ISP and are to be used as an educational or training resource for team members, providing direct support and services to the individual. The completion of the HRST and any applicable HRSPs, as we said earlier, that will align with the individual's annual individualized support plan meeting. So who completes and participates in the HRSP process? The designated HRST rater is responsible to enter the health risk support plan information for the person. So for residential service providers, it will be the RN rater. You would also want the individual for whom the screening is being completed. So you'll be completing these health risk support plans. You'll want the individual to participate as much as they can, because this is what you're doing is identifying areas of the health risk, and you're indicating what kind of needs the person may require in order to safely eat, safely ambulate. This will all be listed out on these health risk support plans so that you could hand one to a direct support professional or whomever is providing supports to the person and see exactly how you need to support this person. Like, let's say I'm an individual receiving services and perhaps I eat very quickly. I'm a choking risk. So maybe one of the supports is a person needs to sit near me while I'm eating and cue me to slow down, cue me to take drinks before bites. That's the kind of thing that you'll see on these health risk support plans. Those tidbits on keeping people safe and decrease risk and decrease stabilization. So I digress. So you'll have the RN rater indicating these things in the system. You'll have the individual serve, they'll provide input as they can, and also a direct support professional who knows that person well. And then if there is somebody else that the individual or your team thinks that would be necessary to be there at the table, then that's totally fine as well. Now we'll talk a little bit about what's called the HRST clinical review process. So when the health risk screen information for a person has an identified healthcare level of 3 or above, well, a person can be a 1 or a 2, which is minimal risk identified, 3 or 4 is moderate, and then 5 or 6 is, very high risk. So those that rate a 3 or higher, have a healthcare level of 3 or higher, will require another nurse to look at that screening, and that's called a HRST clinical review. The HRST is finalized or completed once the HRST clinical reviewer has reviewed and agrees with the completed screen. Note, the process to reach fully rated or agreed upon status may require communication between the assigned HRST rater or the RN rater and the HRST clinical reviewer. For residential waiver participants, the clinical reviewer will be the regional office quality programs or QERN. We're starting to call them quality programs. We're referring to them as that, but you'll know them as the QERN, Quality Enhancement RN. Anyway, it's the regional office RN. They will do a quality check on the HRST or the screening rating according to their training to see if the notations made in the screen support the score for each rating item. The timeline for this review and finalization of the screen is 14 business days. And there will be notifications indicating back and forth when they need to address, go get back in there and look at that. So all of these items that we're talking about follow a timeline, as we said earlier, that aligns with the ISP implementation month. so that the screen and health risk support plans are completed prior to the ISP implementation month for the new plan year. So as I just mentioned, the Assigned Regional Office Quality Program, or QERN, will fulfill the role of clinical reviewer for the individuals receiving residential services. And if just just for FYI, those receiving non-residential services, the support coordinator will be the rater. And there are a team of RNs that work for the company Intellectability, who's our contracted company that created the HRST and the MO DD HRST process with us. Anyway, they have RNs that will be looking at those non-residential ones. That's just FYI. But for residential, the rater is the residential or oversight RN, and the clinical reviewer is the regional office RN that's assigned. So what is the residential RN monthly oversight documentation module? Now this will be housed in the MO DD HRST system as well. The module provides the current residential RN oversight documentation requirements in an electronic format. The assigned residential RN or oversight RN who acts as the rater, they'll go in the system and they'll be required to initiate and complete ongoing monthly documentation in the module the month following the completion of identified health risk support plans. If no health risk support plans are identified upon completion of the HRST screen rating, the assigned residential RN rater in the system will be required to initiate and complete ongoing monthly documentation in the module the month following the completion of the HRST. So where should I submit agency interest in participation? Please, if you're interested, please submit your request to begin implementation and any questions pertaining to the MO DD HRST process to MO DD HRST project at dmh.mo.gov. And I believe Kat has put that in the chat for you all. You can copy and paste it. And as I said earlier, beginning next month in October, we will have a monthly implementation meeting for residential service providers that we will forward an invitation to you if you wish to move forward, and we can discuss next steps for getting that process going for you. So thank you so much for joining today's webinar. Additional information pertaining to the MO DD HRST process may be accessed at, you can see on the screen there, https://dev.mo.gov/DEV-disabilities/HRST-project. Thank you all for attending this afternoon. Please put questions in the chat. As Kat said, we will formulate a question and answers document that will go with this recording. And you all just have a great afternoon. I appreciate you joining us.